patients get a better idea of how a loss of intra-abdominal pressure or that mismatch between the stable and mobile joint pattern might be affecting their symptoms, we'll often use this diagram. So just to get a little bit better oriented here, we've got two versions of this. One is the ideal, one is the not so ideal. And when we're looking at this diagram, it's a torso shown from the side. So we have the spine in the back with the tailbone lower, we have the pubic bone in the front, and we've got the sternum in the front with all the ribs wrapping around. Shown in red here, we have the diaphragm muscle, we have the pelvic floor, we have some of the back muscles, and a general diagram of the abdominal wall. We can use this diagram to show patients what the optimal orientation of the ribs and pelvis should be in order to help their core and pelvic floor function as well as it needs to. So here we have the diaphragm muscle or the ribs stacked on top of, or basically parallel to, the pelvic floor and pelvis. This stacked or parallel orientation can help us to create good pressure through our abdomen and create stiffness, which is very, very necessary for us to have a solid foundation through our core to make sure we can avoid a lot of those common pregnancy complaints. So we should have this nice system in place. However, when we are pregnant, so shown here by the orange curve showing a larger belly, then we'll get pulled into this position where we have more arching through the low back, and we no longer have that good orientation between the diaphragm and pelvic floor or ribs and pelvis. So instead of having that good kind of canister look like a pop can or a toddler belly, we end up with this overarched system, which makes it much more difficult to stabilize and tends to contribute a lot more to some of those common complaints. So just looking at the length of the abdominal wall, you can see when we have ribs, pelvis parallel, there's a lot less stretching going on through here. This is an exaggerated version, but you can see that as we open up the ribs and pelvis, we get a lot more lengthening through the abdominal wall. This can lead to worsened abdominal separation. It can cause more pulling at the pubic symphysis. It can cause more compression through the pelvic joints. A lot of those complaints that we see very, very often in our pregnant patients. Going back to the stable mobile system, we can generate a lot of stability through our core and spine when we're in this stacked position. We lose a lot of that here. So if we end up moving too much, shown here, in an area that should be very stiff, we can throw off that pattern. Similarly, if we have a lot of stiffness through the upper part of the back, which should be very mobile, have a lot of ability to rotate and extend, that can also cause this lower area to take on more work than it's used to. So we use these diagrams often, both during pregnancy and outside of it, just to help patients get a better idea of how some of these changes as far as orientation and muscle activation can be contributing to those complaints.